Sir.
Okay. Ugandans, greetings to all of you. I am here in Kyankwanzi with the NRM MPs elect, the ones who are new to Parliament, the ones who are already in Parliament are still in Kampala debating the budget. But we have got about 300 or so MPs here who are new, NRM and NRM independents. I've decided to again speak to you on the issue of Corona. The other day in the cabinet, we were being asked about the Ramadan. Some people are saying Ramadan has come. The Muslims want to congregate in the night. There are some night prayers that they must participate in. Our strong advice was, please, of course, the Muslim people should pray in the night, but not congregate. Not congregate beyond the numbers the Minister of Health has been advising you. You can pray in your house, you can pray in the mosque as long as the numbers are within the Minister of Health guidelines. This is because observing avoidance has helped us ever since the crisis started last year. Up to now, in Uganda, we have had cumulative people infected of 40,779. And the total number of the infected cases is 41,204. The ones who have recovered are 40,779. So very many have recovered. The 41,000 infected, 40,000 something have recovered. The ones who have died are 337. This is quite a low rate of dying. In the past 2 weeks, the cases had gone down. According to these figures here, I see that hospitalization stands at 24%, 24 cases. And the percentage of the beds used is only 10%. Now, the Minister of Information of Health has informed me that there are new variants, new strains, which are coming into Uganda, especially the South African variant, which they call B1351, has been confirmed in Uganda since the 11th of March. Additionally, from samples collected between the end of February 2021 and 10th March 2021, the ministry has observed more South African variant and severe newer variants known as B1525. The other one is 351. So this 525B is a new one, known as the variant coming out of Nigeria and the United Kingdom. So that means Uganda now is becoming a center of all these different clans of the virus. The original Wuhan, China, I don't know whether it is exactly the same one circulating around Kampala, then the South African one, then the Nigerian one. They are all coming, they are all here already. And a separate, previously undescribed variant that has been labeled the A231 seems to be widely circulating in Uganda. The Minister of Health people say they still do not know how this variant behaves in human infections, but our scientists are trying to understand this. The true extent of the distribution of the new variants in Uganda is still under study by the Minister of Health. However, it is important to note that in other parts of the world, the mutations of B1525, the United Kingdom variant, have shown increased transmissibility. It can infect more. Secondly, increased severity. It makes you more sick, even among the young people, that it can even attack the young people now. Because you remember the original one was not so strong among the young people. And they are saying there is also the potential escape, the potential immune escape, that it is the other American aircraft, the stealth bomber, the one which cannot be seen by the radar, that the immune system will not be able to see it. In other words, the vaccines may not work on this one. Moreover, infection with some of these variants presents unusually with no warning signs of cough or loss of smell and a rapid progression to respiratory failure. What is known from science is that the quick deployment of vaccines and other prevention measures reduces the circulation of the virus in the population and the chances of new variants emerging. Since March 2020, at the onset of COVID-19 pandemic in our country, government has implemented several containment and mitigation measures geared towards limiting rapid spread of COVID-19 among the population, strengthening and sustaining the health system capacity to respond to the pandemic and manage all the other illnesses and conditions. These containment measures ranged from restriction of movement of the population in the geographical locations, institution of curfew, closure of international borders to all passengers except cargo, quarantine of returning travelers, suspension of mass meetings, closure of schools and places of worship, among others. Through these means, government has been able to control the pandemic and avert death and potential unmanageable mass hospitalization and death, which we have seen in other countries. So the figures I gave you, the 41,000 infected, 40,000 recoveries, 337 deaths, these were low because of these measures which we took. Because I think the global figure of infection is now 120-something million. And the deaths are in millions. Millions. In the United States alone, I think I saw the figure of death at 560,000 when I last checked. So therefore, when we advise you to please maintain the measures to avoid, it is because that's really the only effective way up to now. Now, on the issue of the vaccination, despite the observed reduction in the daily caseload and death, it is important to get vaccinated, and infections may soar up again. Since the deployment of the AstraZeneca vaccine that began on the 10th of March 2021, we have so far vaccinated only 200,000 people. We need to accelerate this effort if we are to avoid a catastrophe. Please get out and get vaccinated and protect yourself and your family if you are in the categories that have been lined up for early vaccination. Vaccines are the most effective intervention we have against COVID-19. Vaccines reduce chances of severe disease and death. The government and partners are working hard to bring vaccines to most adult Ugandans to protect them and support us to reopen the economy and get back all our children to school. But do not forget about the other SOPs yet. Vaccines, together with these SOPs, will get us back to our normal lives. On the night curfew, we have, through maintenance of curfew for the last 1 year and various other measures, brought to manageable levels the number of COVID-19 cases in Uganda. Curfew was introduced for the following purposes: lessen the congregation of people and ensure that activities in high-risk areas, bars, discos, and concerts are stopped. Because remember, a bar is not the place where to observe SOPs. Because in a bar, you are talking of drunkards, people who are drunk. And people who are drunk don't know how to take precautions. So those who are pushing for bars without us getting to a level of vaccination which is safe are really your enemies. They are disappointed that you have not died, and they want many of us to die. And we don't support that. We know that that is wrong. We are aware that there have been violations by some individuals that have operated bars in disregard of COVID-19 rules. The operators of these premises should know that they are putting themselves and their customers at great risk of contracting coronavirus 19. support implementation of COVID-19 rules and guidelines that are instituted that restricted operations of high-risk sectors that could possibly lead to exponential rise in cases. Much as the cases seem to have fallen to manageable levels, this does not mean that the COVID-19 epidemic is no more. We need to continue to be more vigilant and observe the standard operating procedures. Wash your hands with soap and water, wear a mask, keep social distance to avoid a bad resurgence. So, in light of the following, evolving nature of the SARS-CoV-2 virus, leading to virus more easily transmittable variants, the important need to protect the most vulnerable population of 3.5 million people who are 50 years and above through vaccination, continuously maintain and sustain manageable levels the numbers of COVID-19 cases who go to hospital, to reduce death through fatigue of the health workers, the unprecedented global vaccine production and supply mechanisms. It is important that we maintain some of the measures that have led to the low levels of COVID-19 cases. We will therefore maintain curfew at between the hours of 2100 hours, which is 9 o'clock, and 5:30. 5:30, what the English call morning, but which we call saa 11:30 za usiku, sawa 11:15 z'ekiro. The Europeans call that morning, but for us we call it night. Night goes on up to 7, when it goes to 7. Benchmarking from other countries, namely the United Kingdom, Thailand, Kenya, Rwanda, and South Africa, we find that the countries that have adopted sustained curfew hours have managed to control the super spreader events associated with the transmission that occurs in the context of illegal and sanctioned activities that mainly take place at night, such as reckless, heterogeneous house parties, bibandas or concerts, disco dancing, and irresponsible social gatherings for the alcohol drinking. The UK, for example, is only starting to lift restrictions on the bars with strict guidelines for the separation of tables with shields, spot test inspections by bar owners, etc. Thus, we are not alone and isolated in making these decisions. On bars, discos, beaches, and performing arts and concerts, these sectors, many of which are associated with drunkenness and super spreader effects, shall remain closed until the country attains a threshold level of vaccination, which, according to the scientists, should be vaccination of over 80% of the 3.5 million elderly Gidudu constituency members. Gidudu is is the leader of the Elders League. You know him, who is now the MP of the Elders. but those are elders of 65 and above. Those are 2 million something. But if you include the 50 years and above, the number goes to 3.5 million. So if 80% of these are immunized, then we can say, okay, we can relax a bit. And two, about another 1 to 2 million of those under 50, but with underlying comorbidities that places them at risk of severe COVID disease. You may be under 50, but you have blood pressure, you have diabetes, you have asthma. Those ones, even though you are below 50, you are still at high risk. And those are 2 million. They're estimated at 2 million. So we are looking at a figure of 5.5 million that should be vaccinated before we can say we are safe. While there is no timeline to this, government is working hard to ensure we bring in another 5 million doses of the AstraZeneca vaccine before end of May to complete the threshold for vaccination and ensure that those vaccinated before get the second booster dose. This, depending on vaccines from outside, is very risky, and that's why I am encouraging our scientists to work around the clock to develop our own vaccine making capacity, and they are doing very well. They are moving. I think by June they would be trying our vaccines in animals, and by August they may reach the stage where they may try their vaccine in the human beings. And for them, they are using all these variants because they have them. They have captured them. All these new types, they have them. Our people are also trying the therapeutics. It's doing well. I'm told the people on which it was tried, 80% have been healed. But the numbers were few. This is because of the success of our program, the numbers in the hospitals are now few. Therefore, our people are trying to get enough numbers to fulfill the study requirements. Because the requirement is that 125 people must be healed. We have now got more than a dozen, but we have not got the 125. But the ones who are tried on were healed, and the three who are still under treatment, they are doing well. So that's our therapeutic seems to be working, but it is, we need enough numbers to confirm this. On the side of the diagnostics, I think that one they are even they have developed a good one, and they are going to build a factory. They are looking for land on which to build a factory. So all this I'm telling you because I want to warn you about the danger of depending on outside when it comes to these very serious matters of life and death. Because like India now has got a very big rise in the cases. They are in a very big crisis. They are struggling to solve their own problems. And here we are waiting also in line to get support from them. This is not correct. I can assure you in the coming years, even by the end of this year, we shall have developed our own capacity to make our own vaccines, because we have got the minimum that is required here. When this crisis came up, I insisted on it, and we have built the capacity, to only that we started a bit late. I have also instructed the Minister of Finance and Economic Development to financially support the actualization of the online platform for performing artists to embrace the digital revolution. The artists can perform online through the internet. You have seen in Europe, people have been playing football in empty stadiums which have no people, but they play, the teams play, because those are fewer. Here in Chankwanzi, we have more than 300 people in our conference here. But because we are observing the requirements, there's no problem. Everybody has been tested. They were all put in the quarantine for 7 days. They were tested again. Only one case was found, and it was isolated. So we are having our meeting. If you follow the requirements, there is nothing that cannot be done. The other time I showed you how I was passing out to soldiers in Kavamba, more than 1,200 officer cadets and young officers. The other day I passed out 4,000 soldiers in Masindi and in Kabarye, the policemen. So if you follow the procedures, there's nothing that cannot be done. The problem are those who recklessly ignore the SOPs. Therefore, for the Ramadan, my appeal is that please, I am also a godly person, and I remember what we learned in our catechism courses. God is in all places. God is omniscient, all-knowing. He is omnipotent, all-powerful. He is omnipresent. Omnipresent. He is in all places. God is here where I am now. It's not a mosque, it's not a church, it's not a cathedral. It is a tent, but God is here. So I can pray here and God will hear me. So therefore, nobody should put our people at risk in the name of praying. That's not religious. That's not religious. That is in the Christian religion, God was very much against the Pharisees. Jesus was very much against the Pharisees, or Pharisee, the ones who wanted to show. And in the book, it says, "Mutagure mitima yanyu, bitari byo kujwara byanyu. Rend ye your hearts, not your clothes." Because the Jews were fond of showing off. When somebody would die, they would tear their clothes to show that they are in sorrow. Muyuzanga emitima gyammwe si byambalo byammwe. Rend ye your hearts. Feel sorry in the heart, not just by tearing clothes. So please, be careful, maintain the SOPs. Let's continue with the struggle for the vaccination. Let's continue with our experiment with the therapeutics. We are getting near success. Our Baganda people say, "Wato before magoba." The boat can sink when it is about to arrive on the shore. I don't want our boat to disintegrate when it is near the shore. We have covered more than 12 months. We have survived. We have held elections. The children have done examinations, the finalists. All the major things that had to be done have been done on time. Let's not make a mistake now. I thank you and I wish you good luck.